So today, I've been so excited for this episode for so long, but we are bringing back return guest, Dr. Nathan Newman, who is a board certified dermatologist, cosmetic surgeon, and stem cell expert. He has spent over 25 years studying the science working with stem cells. So he's also absolutely one of my favorite people. And we're getting a little vulnerable today because your girl had what's called a stem cell lift in March of this year of 2025. And I wanted to come and share my experience with you, share what a stem cell lift is, because it is a way to achieve younger looking skin, not like looking, it actually reverses the skin's age to a degree, builds more collagen, more infrastructure, lifts, sculpts without cutting anything at all, without using anything outside of your body's own natural endogenous resources. So I'll show you a little sneak peek of my before and after here, and we'll dig in and he'll take you through the whole thing. So let's go. So I've kind of been teasing at this for a while now, but I did a thing and I want to take you guys along for the whole journey of what I did and bring in the actual expert, Dr. Nathan Newman, to talk through all the details. We'll have another opportunity for you all to ask questions. We're going to do some follow-up series on this because I think there's going to be a lot of curiosity in response to it. So, Dr. Newman, thank you so much for being here today.
Thank you for having me. It's a pleasure to be here.
If you guys haven't tuned in to my other podcast with Dr. Newman, you absolutely should. So he is a world-renowned stem cell expert. I myself am, and have been for a decade now, a big, big believer in the power of stem cells. I've used them in my family, I've used them myself, and I think they have incredible healing potential. And Dr. Newman has actually dedicated his life to this. So we are really lucky to have further conversations with him. But today we are diving in specifically about something that he calls his stem cell lift. And I wanted to open up the floor for you to tell us a little bit about what that means, what is a stem cell lift, and all the things.
Wonderful. The stem cell lift is really a journey from taking fat and doing fat grafting that was not having great results and really transitioning to the regenerative power of stem cells and utilizing that to replace and augment the traditional facelift. So we don't need to cut and move the tissues in two directions, but actually in three directions. And that three-dimension really restores the youthful proportions, the youthful look. I can tell you about the journey that I took to developing the stem cell lift, because really it was a journey that took me many years as we were trying to figure out what we can do to get better fat grafting. Fat grafting has been around for hundreds of years. It's not a new idea.
Interesting.
The fat grafting techniques have been very archaic and very problematic. Not many good results were coming out of fat grafting. Most people had a lot of problems with fat grafting being hard, lumpy. It would go away, it wouldn't stay, it would cause a lot of poor results that caused many of the people in the cosmetic world saying, this is not good, just don't do it, right? Other people said, well, if this is good but is having problems, how do we fix it? How do we go around the problem and how do we resolve the issues? Because obviously in some people it did well, in some places it did well, so why is it good in this one and not in this one? And I had the fortune of being around the innovators of this. I was around people who were thinking in those terms, saying, okay, what if we do it differently? And what was happening at the time, this is about 30 years ago now, we were taking fat out like we did liposuction. A very aggressive, you would take out all this fat, then you would put it in a sieve, literally, and pour water over it to clean out the blood and whatever else that was there that we thought it wasn't good. Take a spoon, a literal spoon, scoop it up and put it in a syringe. Close the syringe and just go mash, put it in the face or butt or wherever we wanted, massage it in, thinking it's going to take, and it didn't. A lot of people thought the problem was exposing this fat to air.
Yeah.
So they said, oh, the air is killing the fat cells, it's not doing it. What if we don't expose it to the air and we do it in a closed system? We take it out in a syringe and we keep it in the syringe. We don't now put it in a sieve. And we inject it not in just one big lump, but we do it in small quantities. So you have a more surface area that blood can come and keep this graft alive. And we were seeing better and better results as we were doing this. And while we were doing this transition, a report came out saying that when you take out the fat and you put it in the syringe, it layers out into different layers. And the bottom layer is the stem cell rich layer. And that sort of was what made me realize that it wasn't so much the air, but maybe the stem cells that we were getting rid of in the sieve, because we were just pouring it up. And these are tiny, tiny things. You put it in a thing with big holes, it'll go away. And here we're keeping it. So I said, what happens if we were to take those fat that we're taking out and concentrate to get more of those stem cells? Would we get a better result? And the job of the stem cell is to repair and regenerate. It's there is the cell that will help heal you, to replace damaged tissue, to make everything the way it needs to be. The environment that the stem cell is in gives the directions what we want the stem cell to do. If I put the stem cell next to a bone, it'll become bone. Next to cartilage, it will become cartilage. In the fat, it will become fat. And next to the skin, it will improve the skin. So the idea that came around that not only there's stem cells in the fat, which we didn't really understand that before, that the fat has the most amount of stem cells of any tissue in the body.
Wow.
So it really changed everything, because now I didn't have to go into a lab, grow the cells and get a lot of cells, because we already have the cells. We just need to now collect them, concentrate them, and use them. And so I developed this process called the stem cell lift, where I sort of lifted off the stem cells from in between the fat cells. So the fat is like a honeycomb. Everything is connected with fibrous tissue. And when you separate out that fibrous tissue, it releases the stem cells from in between the fat cells. And then they're a little bit thicker and denser. So they will go down and the fat will stay up. So you can either spin it down or you can use gravity. There's many different ways. And you can use enzymes to do that. But I developed a process not to use enzymes, because I was going to inject this back into the person. I didn't want to have that sort of chemical in there. And also the FDA wasn't sort of clear about if you can use it or not. So I said, what? Just do it without the enzyme and see how well we can do. So I developed a whole process where we use a mechanical version of this to use just your syringe and gravity to separate out the cells. Once you concentrate those stem cells, now you can inject it. And you can choose if you want more fat cells, less fat cells, you can change the proportions. If I need a lot of volume, I need more fat, because the fat gives you the volume. If I need just to improve the skin, then I don't need the fat. I need most of this, just the regenerative cells. And this allows us to play with it in a way that we weren't able to do with the enzymes or with the other sort of devices that had come out to do fat grafting.
Wow, I had no idea you could change the proportions and like tailor it per person. That is so cool.
Yeah.
And tell me, what are the most common reasons people come in and look for a stem cell lift or stem cell injections in their face? Like, give me some of the optimal things to treat in this manner.
Most people who come to me for the stem cell lift for a face is they want to look natural, number one, and they don't want to have the cuts. Or they've already had a cut, so they cut and pulled, but they don't feel that they look younger. They look tighter, but they
Mhm.
still don't look younger. So the whole idea is they want to look like themselves just 5 to 10 years before.
Mhm.
So the idea is to restore, is not to sort of make somebody into somebody else or change them so that the things that we do when we change the vectors in the muscles, it changes your expression. So when you're smiling or you're turning or you're doing things, when you animate your face after a facelift, if you know what you look to look for, even in the best facelift, you can tell that is not so natural because you've
Mhm.
changed directions of things. In a in the stem cell lift, we're not changing anything in terms of the muscle movement. So
Mhm.
everything moves in the natural way it does. There's no cutting, there's no stitches, so everything moves the way it was naturally there. What we're doing was rejuvenating. It's really a regenerative process. So that regenerative process brings in new blood vessels, brings in new scaffolding, all the collagen that holds everything up, rebuilds all the volume that was there. And by that, it restores the youthful proportion.
Mhm.
So we always say, oh, people's nose get bigger as they grow older or things like that. A lot of it actually is the fact that you're losing the
Mhm.
volume in your cheeks makes your cheeks flat and makes the distance between your nose and the cheeks longer. So it makes this look bigger. The nose will look bigger. But as soon as I put the volume back and I restore the cheeks and the proportions, everybody says, "Oh, my nose looks smaller. I didn't do anything to it." I go, "It's just proportions. That's why you look good or this way. That's why you look rested this way." Minute you start to lose that proportion, you look drawn, you look tired, you look, uh,
Mhm.
older. But as soon as you restore that youthful proportion, you just look naturally rested and young and healthy. And I think that's what most people want to have. And the other set of people who come to me to do this stem cell lift is they don't want to have the risks. They don't want to have the
Mhm.
risk of cutting their nerves or having the bad scars or looking
Mhm.
done or taking the risk of going on the general anesthesia. Those are the big things that people are looking for.
So let's talk through kind of the process. So let's talk through first, like my concerns. So I met Dr. Newman, went to him after many of you already know, and he knows very well, Rosie, my youngest daughter, who's really medically complex, had a decline in her health a year ago in a few months. And after that, I had lost rapid amount of weight in a very short period of time. I don't think, I mean, I hardly ate for 4 months. I think I ate nothing but Chomps bars. I was like force feeding myself. And I just noticed a lot of sagging, a lot of hollowing under my eyes, jowls, everything. Like I just didn't really look healthy, vibrant. I age like rapidly. I swear I look like I aged 5 years and 6 months or something. So went to him, talked with him about this extensively. And the process is I went and they choose somewhere to isolate fat from, right? Which, for me, it was one particular area that I could never get rid of fat anyway. I just hold on to it there. And it was on my upper legs, like I called it my second ass. And how much fat is needed in an isolated area? Is it always one area? So you're going and you're taking that fat, you're extrapolating stem cells from it. But tell us about that first phase of the process.
The first part of the process is actually choosing the fat that we want to remove, then collect from. So that's sort of the bonus to the person that's getting it. He's taking it from where they don't want it and putting it
It
where we
is.
want it, right? So we've done studies looking at different body parts and if the stem cells are different in the different body parts, if it makes a difference in our outcome. And the results showed that at the end of it, there's no difference. But in the very beginning, there may be a little bit of difference in terms of how fast we get uh, the improvement in terms of inflammation, improved swelling, things like that. So depending on what we're doing, if there is a choice, I will then choose based on that. But if there's a particular place we need to take it from, like in your case, then it doesn't matter. We just take it from where you don't want it, and then that becomes sort of the benefit of doing the procedure over there. The procedure can be done without general anesthesia. You don't need to go under. So that's the first thing that we talk about is, do you want to even take a pill to relax you? Are you nervous or you don't? I recommend for most people to take a pill because it's just a long process. It's a long day. People need to be there for 3, 4 hours. They get nervous. So I just tell people it's better to take the pill. You take a little anxiolytic. It takes away that nervousness and makes you a little bit sleepy, and it's just more relaxed. So if we do that, it takes a few minutes for that to work. Then what we do, there is no cutting with the stem cell lift. We don't have any stitches. We don't have any scars. So we use special cannulas, which are blunt tubes that allow us to go from one spot in the skin. So we make a puncture in the skin with a needle, and then we use the cannula to go underneath the skin to actually reach further in. So we don't have to keep making multiple holes in the skin. And that allows us to numb a large area that we want using a lot of water and a little bit of numbing. That's called tumescent solution. The tumescent solution does many things. Besides numbing, it actually separates out the fat from the surrounding tissues. It prevents us from damaging blood vessels and nerve endings, and it allows us to take out the fat in a much gentler, easier manner, and allows us to get healthy cells where they're not damaged, which is a very, very important part if you're going to inject it back.
Right. And one of my concerns whenever I met with you was I've heard so many people that go to get fat transfers, whether it's breast or whatever it is, and where they have the liposuction never really looks normal. Again, like it just looks ripply or strange. So I was like, hey, what are the chances of this happening? Do you take any precautions to prevent it from happening? And this whole way, this whole method that you do that prevents a lot of that scarring, buildup, rippling. I mean, I would never know that I had the fat removed in the area that I did. Like you just cannot tell. It looks completely natural, completely like I would love to have that 20 years ago. That would have been awesome. But I thought that was one really interesting thing too about the way that you do it.
Thank you. First of all, I appreciate that you didn't do it 20 years ago because I needed that.
Yeah, me too.
You're very thin. So the process that we had to actually come up with was not just about the stem cells, but how do we keep them healthy, right? How do we keep those cells healthy and alive? So we studied not only the injection part of it, but also the extraction. So we had to look at if we do regular liposuction with a lot of, suction on there and very aggressive tips of the cannula. Is that good, or do we need specialized tips? Do we need less suction, less pressure on the cells so they don't burst, so they don't get damaged? And all of those things makes a big difference in the outcome. So we actually use no machines. I use my hand with very little suction to bring out the fat in a very gentle way. And that makes it a little bit longer to get the fat because we're not as aggressive, but it makes it much more comfortable for you because you're awake. And two, it makes it much less likely to damage the cells or damage any part of your body or to create deep ripples or unevenness in the skin because we're not aggressive. Everything is done smoothly. A lot of is technique and how you have the ability to do it. So you need somebody who's trained, who knows how to do it, to do this. But once you know how to do it, the fact that we're not so aggressive makes it
Mhm.
much less likely to have issues, of healing or damaging the area and having uneven look to the skin afterwards.
Yeah. And during this process, like while this was happening, I definitely chose to take the medication. And he even offered, he's like, "Do you want one or do you want two?" I'm like, "I'll take two, please." But I was awake enough. You're like in kind of sleep awake where I know I had to roll over a few times and I remember that. But the in between of this part of the process, I don't really remember. I think I was just sleeping awake when you would wake me up, and it went by in an absolute flash, completely comfortable, never. I would be awake enough to know if I felt uncomfortable or pain. It was nothing like that at all. So take us through the next step. So you take the fat, you have it now, you've gently removed it, and what happens next?
Right. So we use the cannula to numb it, but then we use another cannula to remove it. And we then clean up the area that you we went to get the fat, and we bandage it up so that all the water that we injected is going to leak out into the sort of the pad that we put on there. But the next day, that area will dry up. You'll be sore in that area for a couple of weeks, like a muscle soreness after a workout. And then you can tell me how long it took for you to be able to go back to doing your sports. But usually it's about 2 weeks.
Yeah, for sure. 2 weeks. Very mild, super easy in terms of pain.
So, and then we basically now take all that cells that we took out and we start the process of concentration and separating the stem cells from in between the fat cells, concentrating them. And we do that a few times to really release as much as we can and concentrate as much cells as we can, which we're talking about millions of cells. So we're talking about a lot of cells that we're getting. While that's happening, sometimes I add PRP, sometimes I don't, depending on the need of the patient. The PRP doesn't really change a whole lot. It just may boost the effect of the stem cells if it's needed. So in joints, I usually do add PRP because most people are very inflamed and it helps to reduce inflammation and boost their things. In the face, I sometimes do, sometimes don't, depending on how you are. In your case, your skin is very, you have very good skin, you have very good bone structure. You were just hollowed out more than anything else. So you don't really need so much of the PRP. So the PRP will cause more of the swelling, downtime, and if we're just doing stem cells, is much less downtime with it because the stem cells don't create all that inflammatory process. So once we concentrate the cells, we numb the areas that we want to inject, like going to the dentist, we just do nerve blocks, a couple of places. I use again a little needle to pierce the skin. And when we inject the cells, we use a special cannula that is a blunt edge cannula. So we don't inject anything sharp because we don't
Mhm.
want to inject anything into a blood vessel. So
Mhm.
it is really for the safety. And also because it's long, I can go from one or two or three spots and do an entire face.
Right.
So I'm doing an entire facelift with like a cannula and three piercings into the skin. And those little needle marks close up within a couple hours. You don't even see them the next
Mhm.
day. So the whole idea then becomes the art of medicine. It's really about sculpting.
Mhm.
Where does where do we need to put more cells? Where do we need less cells? What kind of cells do we need to put in one area versus another area? Do we need more stem cells or do we need the fat and the stem cells together? In many cases, I don't need anything else besides that to get the results that we want. Sometimes, if we have a little bit of loose skin and we want to do other things, we can add other devices to the treatment. We can do radio frequency devices or lasers or other treatments that we do in conjunction, not only to get the tightening, but also to stimulate the skin. And that will signal to the stem cells what we want them to do, because
Mm.
that damage is signals to the stem cells, come heal me, come, I need to get more rejuvenated here. And it sort of boosts the effect. So a lot of times I do chemical peels or I do different things to get that sort of stimulation so that stem cells get the direction what we want them to do.
I love it. So smart, right? They get the signal, the communication. I'll say too, I think my biggest takeaways and the biggest things that I wanted addressed were like under my eyes, just really hollowing. I got a very defined line here between my lower cheek and my under eye where it just was almost like a pinched out area. And then I had pretty significant, I mean, for me, significant jowling, just overall sagging. I sent one of my after photos to you that was, I don't know, probably like 6 weeks after. No, it was probably 2.5 months after. I'll have to look at the dates and I'll put it here. But the lifting on my face was absolutely blew my mind when I looked at it. It was night and day and just restoration of not even necessarily overt volume, but definitely just lifted, natural, glowy, firmer, more taut skin. It was, I mean, absolutely incredible. I'm trying to think the other thing too that I really noticed, like the quality of my skin, my pore size even was smaller. Yeah, just the lift. It was really the lift. And we talked about this before we started recording, but you're like, hey, has anyone noticed that like you look different or anything? No one. Like I told you this before, my husband wouldn't have known that I did this. He would just be like, you look really rested if I didn't tell him. Like my biggest concern whenever I came out, and I want to show the photos of like the after, right after, especially like the really funny one, but you re-inject all of these tiny little amounts, right? It's just small placements. You can tell us exactly how to do it if you want to expand on it, but just little small placements of these stem cells. But then it triggers this reaction where everything swells. And my first thought when I woke up and looked in the mirror was, did we just really just inject a whole lot of volume into my face and I'm going to look crazy? And the answer was absolutely not. Like, I was like, okay, is any of this volume occupying? And you guys were like, no, this is all going to fade. This is just swelling. And then your body will do its own thing. I'd love for you to tell us about that part of the process.
The hardest part about this procedure is the swelling, right? So because we're using cannulas and we're going from, one place of the skin and all the way across to another part, the cannula going underneath the skin itself, even if I don't inject anything, will cause swelling. And that's really what causes most of the swelling, is that
Trauma.
trauma from the cannula going back and forth causes the skin to swell. But because it's not sharp, we're not cutting anything, we're not scarring anything. So the healing is relatively fast. The cells themselves give a little bit of volume, but most of the job of the cell is really to restore. Is to restore proportions, restore the anatomy, restore the elasticity. And this is a biologic change. It is not like doing a traditional facelift where we physically move tissues, where you immediately see the tightening because we're doing a physical tightening. Here is a stimulation. You're telling the body, I want you to do this. And it takes time for that to happen because it takes 3 to 4 months for new collagen, for new elastin, for everything to sort of be reproduced and renewed. You're setting off a whole cascade of regeneration. And that takes about 3 months. But most of the swelling from the cannula goes away within 2 to 3 weeks is like the maximum. Most people, even before that, start to look normal. Even the next day, most of the swelling from the cannula goes down. And then you get the secondary healing that comes from your body reacting to the signals of the cells. So for 3, 4 days, it actually continues to get more swelling and then it goes down. And that's why you get that 2 week window.
That was definitely my experience. And I'm like a puffy person. I'm a sweller. So if someone tells me you might swell some, I'm like triple it. And I did. I mean, I was swollen, but I knew that. Like you prepped me to and primed me to prepare for that, and I was. And if some people look back at some of my social media posts, like I didn't post for a while, a couple weeks, but I had to do one like interview with for new US News and World Report, and I could totally, I was still quite swollen. So you can find those and you can see them. And I'm going to add a lot of photos week by week of the swelling here as well for you all to see, but 100% worth it.
The swelling is the part that most people get disconcerted with. So they
Mhm.
think, oh my God, what did I do? I'm going to look like this. And I'm like,
Yeah.
no, it's going to go away. The first time I did it did the procedure and I was
Mhm.
doing it and I saw the patient, I go, what did I do?
Right, I bet
I'm
you
like, oh,
did.
it's not up here. But since then, I've gotten much better in terms of keeping that swelling down as much as we can.
Mhm.
So it's much better, but you still get the swelling.
Yeah, that's part of it, right?
Yeah.
It's part of the signal too. That's what we want. We want to trigger the trauma response enough to send all those stem cells there and make sure they stay there. I have wanted to bring up too. So tell me like a couple other questions. How long, generally speaking, after you have a stem cell lift, do your results kind of last? What is the expectation? Like, I know filler is something that like you do and you're supposed to re-inject it every year and Botox every few months, but tell me a little bit about the longevity of this.
So this is very different than any idea of a filler because
Mhm.
although we're giving you volume, we're not giving you volume, we're giving you regeneration.
Mhm.
So it's a completely different idea. It's not something sitting in your skin. It is
Mhm.
actually your body, your skin, your tissues that are regenerated and renewed. That change is a permanent change.
Mhm.
So at 3 months, whatever has taken, whatever has grafted into to your body is a permanent change. But
Mhm.
the regeneration doesn't stop there. You continue to get better over the course of the year. It may not be as dramatic, but
Mhm.
over the course of the year, your skin keeps improving because that's the biologic process.
Mhm.
So after a year, you've reset the clock. From there is how will you look in 5 years? How will you look in 10 years? How well will you age? That's the
Mhm.
question
Yep.
because we've turned back the clock. And most people, if they look at their pictures every 5 years, they will see changes. If you look at yourself from
Mhm.
1 week to another, you probably won't notice it, or 1 month to another, you won't notice a big change. But if you look at time frame of 5 years or 10 years, you will notice changes in your volume, in your skin elasticity, in just the aging process that's going on. Unlike a traditional facelift where we sort of pull everything tight and then like somebody like you who already had lost the volume, if I were to do a traditional facelift on you and pull everything tight, you, you would look tighter, your gels would go, but I couldn't do your eyes like that. If I had to
Mhm.
do your eyes, everything would be cut and pulled,
Yeah.
but you would look a lot older because what
Mhm.
I ended up doing was just tightening all the sort of hollowness and make them
Right.
more skeletonized.
Right.
So by undoing that, you're going to look better in 10 years from now than you did 10 years ago, right?
That's so
So 10
crazy.
years, you will still look better. Will you have aged a little bit? Will you have a little bit of wrinkles? Yes. Now, unlike traditional facelift, where the secondary facelift is so much more difficult because
Mhm.
we've cut everything, we've moved everything, the risk is so much more in terms of damaging nerves or damaging the skin and getting scars. Here, actually, is better. You have more of
Mhm.
stem cells that you put in, they're still there. They may
Mhm.
not be as active, but they're there. So when we go back to inject it, the regeneration is faster, better, and you need less of it. And
Wow.
it's sort of contradicting what we used to do. Like the
Mhm.
first time is great, the second time is harder. Here, we do it the first time is great, and the second time is even better. So it's it's opposite of what we were
Right.
taught.
That's so awesome and also makes me so excited, like personally, that in the future, if I do it again, it'll just be great too. I did want to add, I have one friend who actually introduced me to Dr. Newman. I won't say her name here, but lovely, lovely friend of mine. And she had like chronic under eye bags, even as a young person. She went and had stem cells specifically injected into her under eyes. And I saw pictures of her before, and obviously I know her after, and it is dramatically, honestly, it's life changing. Like this poor woman, she's beautiful and just had these deep hollows, deep genetic based bags. And it's been like, hasn't it been 15 years?
Yeah, yeah,
Yeah.
absolutely.
It's been
So she was in
15
her
years.
20s. She was in her
Right.
20s. And when she came to me, we had two choices. I could cut it and
Mhm.
take out the fat pad,
Mhm.
and she would have a hollowed out look under her eye, and it would make her look older. Or we could do the stem cells, and she would look more rested. And I'm glad she chose to come to me and do the stem cells because it really restored her beauty. It was about the proportions that we talked about.
Mhm.
That sort of genetic thing that she had, where she had this hollowness here, made her look aged. And as soon as we sort of corrected that and restored a natural proportion, it was transformative for her.
Mhm. And really, she looks better now than she did 15 years ago. Like her eyes look still to this day so incredible. It's so exciting. Like it really is. It's an exciting time to be a woman. I know that we're going to have a ton of follow-up questions about all of this. And so we're going to create a place where we can answer all of y'all's follow-up questions because I can already see how this is going to go. But I also wanted to bring up a couple things. One, I know you have a book coming out. Perhaps you could share a little bit with us about that, maybe some pre-order information.
I'm doing a new book that I want to educate the people
Yeah.
that the idea of stem cells is an amazing thing that is not just an idea anymore. It is a reality that you can use for your benefit today. It is
Mhm.
not something that's going to come only in the future. The future is here.
Yeah.
People can do it here and in this country. Just last week,
Yeah.
the Kardashians went and posted about their journey of stem cell treatments in Mexico. They went there because she had back pain and she got stem cell treatment, and there's different kinds of stem cells, and that's a whole different discussion. But it was not her own stem cells that per se that they were doing. So the the great thing is that somebody like her, when she posts something, it
Mhm.
generates a conversation. It brings awareness, and we definitely need awareness about this amazing technology that's out there. And that's really why I wrote the book. It's about my journey in stem cell world. And it's about the fact that I want to educate. I want to educate people about what they can do with the power of stem cells in their own body,
Yeah.
that they can heal themselves, live. We're living so much longer, but we should be living optimally. We should be living healthy. We should not just live with a number that I lived to
Mhm.
whatever age was, but I lived great to that
Mhm.
age. I did everything I wanted to do by that age. I was still on my feet. I was
Yeah.
still vibrant. I was still functional. And that's where we want to be. And that's where I see medicine going. And I see the stem cells leading us in that direction.
Mhm.
Um, and I think people who are interested in being healthy, looking good, and using the natural healing powers of their own body, stem cell is the most powerful natural
Yeah.
healing agent in your body. And we have the ability to harness that. And we have the ability to use that for the benefit of people. Because, yes, we did stem cells for cosmetics, but I've done stem cells for joints and for wound healing, for post cancer reconstruction, for autoimmune disease. The list goes on and on. And if we are not aware that that's an option,
Right.
then we don't know if we that's the right thing for us to do or not. But my job is to tell you there is an option.
Mhm.
Is it the right thing for you? That's a different question. It's another tool. It's another
Right.
tool that is it's a revolutionary tool. It's a tool that we didn't have before. So if we can utilize that to make your life better,
Mhm.
then you should know that that option exists and know where you can get it.
And know that like there was so much controversy about stem cells in America, for so long, and it's still, I think, extremely misunderstood. Clearly, like when I go and you take stem cells from my fat, we're not taking them from baby fetuses or anything like that, right? Like there are very natural, not harmful ways to gather and garner and be able to use stem cells. So important. Thank you for educating people on that. Tell us the name of your book, and is there a place that people should go to stay tuned for its release? I know it's coming up soon.
The book is going to be called The Natural Intelligence of Stem Cells, because I believe in the use of the natural intelligence, the healthy, normal way of using the cells without adulterating it. And from that, I actually talk about how I took the stem cell from my clinic and I saw what it does, opened up my lab and created a whole technology, biotechnology that we have developed and patented that is being used to treat burns and bring health to a lot of tissues, and not only use human stem cells, but also plant stem cells, because the language of the stem cell is so universal. It's so amazing that all cells use the same language. They may have different dialects, but they use the same language. And we were able to sort of break the code and be able to use that and create products that makes it available, that not everybody needs to go and have a procedure done, where you can benefit from that technology that we've developed from the cell itself to the bottle. We've developed a whole technology where now we can bottle that consortium factors, the factors, the language of the stem cells, where you can apply that on your skin and get benefit from it like we've never done before. And that's part of the book and part of the journey and education about what things we can do. Everybody can find it on my website, nathannewmanmd.com. I'm here to help anybody who I can help.
Yeah. And just to plug his development of the skincare line, it's called STEM. If you guys follow me on social media, you for sure have seen me talk about it. I have used it consistently now for almost an entire year, twice a day, literally every day. The serum is it is the first thing to touch my skin after I wash my face. It has completely gotten rid of redness. I had rosacea that I've probably spent $4,000 trying to treat and maybe got 10% better. I don't have that anymore at all now. And it's literally changed since using that. I love it. I think it also contributed even potentially to improving the recovery process post-op. And I used a whole slew of his products to get me through that I heavily relied on. Cannot encourage you guys to try STEM enough. I use literally their entire line. But if you want to start with one product, I would say it's the serum for sure. The serum is a great starting point, and you can launch out from there. Anything else we should know, Dr. Newman? Thank you so much for your time today and just your dedication to this. It changes lives truly in so many ways.
Thank you very much. This is amazing that I have the opportunity to not only do the podcast with you and actually see, the wonderful results that you had from the stem cell lift. And I'm really honored that you chose to trust in me and let me have that journey with you. And I'm very appreciative of everything you've done. Thank you.
Oh my gosh, I trust you more than anyone for sure. Well, thank you so much, and we'll see you back here soon.
Great. Look forward to it. Bye-bye.